everybody, let us return again to discuss our surgical anatomy series. Today we will apply our knowledge on the abdominal and pelvic lymph node. We will create a smart roadmap and how we will apply our knowledge not only for the exam, also in the operating room. So by the end of this video, you will find yourself able to make your checklist before going to your operating room. This is our roadmap. It can be appear in the first as a complex. We will simplify in this video to illustrate our knowledge. First group of para-aortic lymph node lie lateral to the aorta, and there is para-caval nodes on the inferior vena cava. In the para-aortic lymph node, we can see pre-aortic, retroaortic, and lateral aortic. In the para-caval node, we will see also para-caval, retrocaval, and lateral caval. So it's very easy. The third group of nodes is the common iliac nodes. We can see in the diagram the common iliac artery, and it's passing anteriorly by the ureter at the level of the pelvic frame, which is a very dangerous surgical landmark we discussed before in many videos. For the group 4, it's the external iliac nodes. Group 5, internal iliac nodes or hypogastric nodes. Our applied anatomy here is to preserve our preservation of the sympathetic and parasympathetic nerves to preserve the avoid dysfunction of the urinary bladder and rectum. Our sixth group is the obturator nodes, very important also to preserve the obturator nerve in this side. So our applied anatomy, how to preserve our sympathetic, parasympathetic nerves and the obturator nerve, especially in the gynecology, oncology, and gynecology, urology. So let us start to simplify, more simplification. We can see in the abdominal lymph nodes, we can see unpaired lymph nodes related to the celiac trunk, superior mesenteric artery, and inferior mesenteric artery. And we will see lateral aortic or lumbar nodes, which are paired lymph nodes. Also, the pre-aortic nodes can supply tests or ovary according to the gender. After that, we will see the common iliac lymph node and the external iliac lymph node and internal iliac lymph node. The deep inguinal lymph node and superficial inguinal lymph node. Let us focus on our related gynecological organs. In diagram A, we will see the ovaries supplied by the pre-aortic lymph node, the fallopian tube by the pre-aortic lymph node as well. So the uterus is divided, the upper limit related to the ovaries and fallopian tube, which will be supplied by the pre-aortic lymph node. In the middle will be supplied by the external iliac lymph node, and the lower or uterine isthmus will be supplied by the paracervical lymph node, and vagina, as we can see, the upper vagina supplied by the internal iliac lymph node, and the lower vagina supplied by the superficial inguinal nodes. In diagram B, we can see the sacral node, the cervix relation lymph node, posteriorly sacral nodes, and lateral, posterior lateral is the internal iliac node and external iliac node. We can see the obturator node in the medial. This issue for the lymph node as well for the rectum. Above the pectinate line, it's supplied by the internal iliac node and para-rectal node, and below the pectinate line is supplied by the superficial inguinal node. So again, our map, again after our video, but now it's more simple and clear. We can see the first group, para-aortic node, supplying pre-aortic, retroaortic, lateral aortic, supply the kidney, adrenal, and the testes or ovaries according to the gender, as we explained before. Group 2, para-caval node, pre-caval, retrocaval, lateral caval as well. Group 3, common iliac node. Its common iliac artery is crossed by the ureter at the pelvic brim, which is applied surgical anatomy danger zone. Fourth group, the external iliac node. Fifth group, internal iliac hypogastric node, our applied surgical anatomy here to preserve the sympathetic and parasympathetic nerves to prevent dysfunction of urinary bladder and rectum. The fifth group is the obturator nodes. We have to apply our anatomy here to preserve nerves of the obturator nerve location for gynecology, oncology, and for the urogynecology operation as well. So our applied anatomy here, as we can see in the right side of the map, preservation of nerves, sympathetic and parasympathetic, and preservation of obturator nerve location. So before going to the operating room, please apply this surgical anatomy checklist. Very important for ureteric safety, identify at the common iliac bifurcation, and nerve preservation to protect sympathetic and parasympathetic chain to avoid bladder and bowel dysfunction. And vascular landmark psoas muscle is your lateral boundary, and inferior vena cava aorta are your medial limits. So before going to the operating room, kindly subscribe, like the video, and share it with your colleague, and subscribe in the channel for more videos.